So it sounds like they're really coming into a whole new healthcare culture, and need a bit of a primer or benefit from a bit of a primer as to how that civilian healthcare culture works.
It does. It is fundamentally different. I mean, obviously, if they, are or were parents and they had children or other people in their own family who had certain medical issues and they had to take their prescription to the pharmacy, they would know. But many of them surprisingly don't. And they are a bit surprised when you give them a prescription and say, well, okay, now what do I do? Because in the military, they just go down the hallway and the military pharmacist would give them the prescription free of charge. So that's something as simple as that you do need to explain. And so it is not something that you can do in a 10 or 15-minute appointment. So for me, every new patient, I have 1 hour split into 30-minute two appointments. First one, I sit down and take a comprehensive history and basically develop a cumulative patient profile, and I go through some of these cultural issues. And then they come back at another time for another 30 minutes. For me to do a very detailed, what I would call baseline physical. So it's time consuming, and if you're really really busy and you're not designed that way, then you're gonna miss that interaction to get to know the individual and setting off that starting point. So because if you only have a 10-minute appointment, then you're really going to touch the surface, and they're going to go away not really understanding what the system is, and that may be setting it up for their failure or disappointment or miscommunication or otherwise.
Dr. Jung, you have a veterans focused practice specifically. Do you have any advice for those of us who have a mixed practice or may have a small number of veterans in our practice, how we could create a veteran-friendly environment in our clinics?
This is something that I do, but I'm not sure whether this can be replicated by non-military physician, or rather physicians who do not have any military experience. So when I take the initial intake history, I start off by asking them what their rank was when they released from the military, what their occupation was, when they retired, how many complete years of service they've done, and what was the reason for their release. And those questions are probably something that most civilian doctor never even thought about, because it's not really considered medical, it's a bit of a social. But for me, the rank tells me, the level of leadership and level of exposure to whatever occupational trade that they were at. And combining the rank with trade tells me the type of sort of mental and physical demands that they may have been under, and therefore what kind of injuries or bodily stresses that they may have come under during their career. The number of years tells me their sort of financial status. So if they have 35 years, they have a decent pension. Anybody with over 20 years is going to have a pension and pretty financially reasonably secure. Also, if they have more than 10 years, generally speaking, they're going to have a public service healthcare plan. So they're going to have a full medical insurance for all the drugs will be covered, but generally speaking. And also most likely, they will also have dental care. And the type of reason for the release, for example, somebody with 35 years may say, or more than 20 years may say, well, I just had enough and I decided to go and find a different path. And that's one thing. Or somebody might say, I was released because of medical grounds, meaning they were no longer able to serve because they have limitations. And then that tells me that they have some issues, which means that they will have various likely claims with Veterans Affairs Canada for certain disabilities that they may feel that they were caused or contributed by their military service. So all this sort of information gives me, without even taking the medical history per se, a good insight into their their career in the military, and therefore what kind of exposures and experiences they may have experienced or endured, and what kind of administrative support they may be entitled to through Veterans Affairs Canada. So those information within the first 2 minutes gives me a wealth of information. But if you have no experience in the military, so you don't know what a trade is, and you don't know any of that, then it's probably not all that useful to the individual. Now, also by getting, talking about the military, I immediately developed that sort of connection because I'm also former military. And many, in fact, I suspect most appreciate that. They find that connection right away. But if you're a civilian, you have absolutely no experience, and you ask some of these questions and you have no idea what that means, it may be counterproductive to do that, because then the patient has to explain and they may feel, oh, I'm talking to somebody who knows nothing. So you might be judicious on whether you want to ask those questions, depending on your level of experience or how much you've researched into it prior to seeing the patient.
There's a wealth of information in those just few questions, and I think it speaks again to the importance of understanding the military culture, and as well the link between military healthcare, veterans healthcare, and occupational medicine. Is a lot of what you're describing there really fits within an umbrella of occupational medicine. Could you comment on what you do personally in your practice in preparing to meet a new veteran patient, and what that intake process and first few appointments look like?
Yeah, so to me, this is extremely important to get the to have a good starting point, and I do provide adequate time for this because it's not something that can be rushed. The individual needs to get comfortable with the new doctor, especially in a civilian system that they're not accustomed to. So I have my intake process for new patients consists of two 30-minute appointments. First one is basically a conversation, discussion, and I take a detailed history of and develop a cumulative patient profile. And it includes such things as rank, their occupation, their release date, number of years of service, reason for release, and other areas, things like spousal situation, their employment, children, and so on, and past medical history, and so forth. All of these are aided if they come with a copy of their release medical that they got just before they got out of the military, because this provides an objective information, because not every patient remembers everything of their past medical history, nor the various medications they may have been on prior to. So that's extremely important. So once I've done that, and that usually for me, especially if they have any significant musculoskeletal and mental health issues, can easily, occupy 30 minutes or more. Then they come back for what I call a baseline physical. And this is extremely important. And I do this baseline physical very detailed, particularly the MSK issues. But I mean, all areas of the system, but particularly MSK, because mental health and MSK are the two major issues that afflict the military individuals after release. So I like to take a complete functional and almost a measurement of their movements and joints and so forth when they are in the office with, as part of the initial intake, when there are no potential other interests at stake. So they're fairly relaxed, and generally speaking, I get a very good baseline. Why I say that is because many of these individuals may come back weeks, sometimes days, to months, sometimes years later. Years later, not so much, but sometimes they come back weeks later with a medical form that they need completed for Veterans Affairs Canada because they want to claim a condition. And, if within a matter of days or weeks, their examination changes, because now they're there for an examination so that they can apply for some disability, having a baseline when no such, interests were there, and you see a significant difference, gives you a sense of, subjective and objectivity related to their functioning status. So I like to get a really detailed baseline physical. And also, one thing that's something most doctors should be aware of is that if somebody is released medically from the military, they have some significant benefits because of that. So, for example, they are entitled to 2 years of what's called vocational rehab, meaning they can undergo retraining at government's cost to become, to seek a different profession. Most of the time, their salary is also topped up above their retirement pension to something like 90% or 95% of their pre-retirement pay. And if after those 2 years, if they're deemed to be fully disabled so that they are unable to, find another occupation, they get financial support up to the age of 65, above and beyond their pension. So those things tell you that financially, many of these individuals are not hard up, and they're quite good. And that, of course, being financially secure has a huge impact on their physical and mental health also. So that's what I do. So I take a good amount of time to get a good history and a really good baseline physical, because they come in very handy as you move down the line.